Okay, so here's an explanation of the psychopharmacology that's happening in the neurons. So at the synapse, we have, and this is where the action is actually taking place. So if you're giving any of these drugs, antidepressants, antipsychotics, benzodiazepines, psychostimulants, these are all disrupting in some way the neurotransmitters. So, antidepressants, for example, block reuptake of serotonin and norepinephrine. So, that's how they work. So, this is what's basically the bottom line when it comes to giving these drugs is we're expecting that it's going to have an effect on these neurotransmitters. So just, review some of these neurotransmitters. So for example, when we're talking about blocking reuptake of serotonin, serotonin originates from cell bodies located in the pons and medulla and project to areas including the hypothalamus, thalamus, limbic system, cerebral cortex, cerebellum, and spinal cord. Serotonin that is not returned to be stored in the axon terminal vesicles is catabolized by the enzyme MAO. And serotonin plays a role in sleep and arousal, libido, appetite, mood, aggression, pain perception. So, this system using serotonin has been implicated in certain conditions like anxiety, mood disorders, and schizophrenia. So, each one of these drugs that is an antidepressant or is an antipsychotic works in a certain way so that it's blocking, usually blocking, okay, or facilitating or increasing release of. So we have either or. It depends on what they're being used for. And again, if you go to the chart that's got all the neurotransmitters on there, if a neurotransmitter has a decreased amount of it for a certain disorder, then that's when we may want to get more of that neurotransmitter in the body, in the brain. Okay, so it really depends on what we're using the drug for, in which case. All right, and some of the implications for nursing. Again, we want to be able to help the patient have the best outcomes and be safe and be able to manage their stress to the best of their ability. So, we're going to be trying to use both meds and their social world in the milieu to be able to develop their own coping mechanisms and be able to help them transition to be home. There's a lot of new brain science and research going on. We have to incorporate when it comes to nursing. We have to be up to date on current practice. We have to be educated and look at the newest research to be able to do that. So in this chapter 3, I'm talking about, focus on the tables that I mentioned previously, the tables that talk about both the neurotransmitters, the hormones, how those are affecting and how those are related to some of the disorders that you're going to see in mental health. Look at the circadian rhythm. That's something you should know about as well, because again, patients that have mental illness always seem to have trouble with their circadian rhythms. Sometimes we have to give melatonin to help them, but often it's just that they have trouble sleeping because of the neurochemical influences, the role of GABA, the REM cycle, use of benzodiazepines. Okay, so that's why we do focus on the circadian rhythm, and that's an important thing for you to know. And then we talked about genes, but biological implications of psychiatric disorders, looking at the genetic links to those and the neurotransmitter, hypothesis. And that again is another table 3-4. So this book has a lot of tables, but it's important for you to kind of use them to as a guide, a way to study your for your exams, because that's a good way to study using some of these tables. All right, we're moving on. Chapters 7 through 8. So this is all about the relationship, and this is the old textbook, but I guess I didn't update that with the new textbook, so I'll take that out. But this is the same authors, just a different cover. Chapters 7 and 8 talks all about the relationship development and therapeutic communication. And this is so important when it comes to working with your mental health patients, because this is where the rubber meets the road. In other words, you have to develop a nurse-client relationship, and that's a foundation for helping patients progress to being ready to be discharged. Okay, so having a good relationship, understanding how to have a good relationship with mental health patients, and being able to facilitate communication is really key into working with folks in this environment. So you have to not only understand what are the aspects of good relationships with your clients, but also how can I have a therapeutic communication, therapeutic relationship that our communication back and forth is effective and it is meeting the needs of the client, okay? So that's what we're going to focus on with most of the chapters 7 and 8, focus on role and relationship on 7, and then in 8, really about the communication, therapeutic communication. So when we think about therapeutic communication, think of the use of self as an instrument in caring for the patient and delivering care. That's what this is saying here. Intercommunication techniques are really your tools, your toolbox for helping patients with mental health disorders. That's how you actually help them, which is a lot different than med-surg when you're giving medications and you're doing, more of an assessment and maybe some treatments to be able to help them. But in this role, you're using more of your communication techniques. So what about the nurse-client relationship? So you have to think about the goals that the patient is needing. So a lot of patients will be in there with goal-specific sort of treatment. So when they say, okay, my goal today is to go to 2 groups, be able to sleep 8 hours and eat, my 3 meals a day, and maybe it's going to be writing a list of things they need to accomplish. It's not going to be huge at first because, they've gone through a huge stress, a huge level of where they couldn't even function at home. That's why they're in the hospital now, okay? Something altered their ability to continue living a normal life. So it's going to be basic goals at first. Some of them are just going to be basic needs, like on the bottom of Maslow's hierarchy, right? Taking a bath, getting 8 hours of sleep, having a shelter, a place for them to feel safe. These are all important basic needs that we're working on meeting while they're in the milieu. And the milieu is supposed to represent a way for them to practice communicating with not only us, but with their peers and other people in the milieu so that they can function in society. Think about it. Everyone has to function in society somehow. So the book gives you some examples. For example, on page 136, a goal. The client will demonstrate more adaptive coping strategies for dealing with, think of a situation with dealing with family members, with dealing with job stressors, with dealing with, maybe it's managing home finances. It could be a variety of things. And then interventions. Identify what is troubling the client at the present time. Encourage the client to discuss changes he or she would like to make. Discuss with the client which changes are possible and which are not possible. Again, your interventions are communicative, okay? So I want you to, really focus on that part. Therapeutic use of self, again, describing the instrument for delivering interpersonal nursing. The communication is the tool, is the therapeutic use of self. Okay. Um, Goals are often achieved through the use of problem solving. Yes, the client is going to have to problem solve. The practicing of problem solving is where the patient can, do that in a safe environment. Sometimes it takes them a long time. I remember seeing a lady a year or two ago who was so depressed, severely, severely depressed. That is one of the common things you're going to see is depression. And she was so severely depressed, she couldn't manage, bathing. She couldn't manage doing her finances at home. She couldn't manage, paying her bills, talking to her family, going out shopping. Very basic things were really hard for her to do. So we kind of adjusted her medications. We had her in there for med adjustment. We had her in there for going to groups, setting goals. And she actually did. She had a list of goals, but some days it was really hard for her to accomplish one or two things. Okay. So these are the things that we do. Try to identify the client's like big list of problems, and it might only be a couple of things they start off working on. Try to promote some discussion of the desired changes. What do they want to do? What do they want to focus on? Some of them will say, I just want to focus on going back home. Well, what is it going to take you to get back home? Some of them want to focus on improving their relationships with their partners or their spouses. What is it going to take to get to that desired change? Okay, what do you need to do for a goal? And then discuss how sometimes things are not going to be realistic and some things are going to be realistic. Let's try to help them focus on the realistic things that can be changed. And then discuss strategies for creating changes that the client wants to make. What kind of strategies can those be? How can you make that work? Maybe it's going to be, instead of you focusing on fixing your checkbook, why don't we focus on, do you have all of your money deposited in your checking account? Okay. Now, what is the top bills that you need to pay? Let's make a list, and it could be other things. It could be like, okay, what is the most stressful part of your relationship that you want to work on? Is it arguing? Do you guys need to set up time to meet with a counselor? So, I mean, you're going to have to help them set their own goals. This is about them learning how to problem solve. So again, setting goals, weighing the benefits and consequences of alternatives, helping them select alternatives. That maybe they tried something, it didn't work. Let's look at an alternative. They need to be open to change, right? They need to be providing feedback about themselves. So they need to do some critical feedback, and you're going to also provide feedback for them on the things that they have attempted to try to change. And you're going to give them positive feedback when they make positive changes and meet some of those goals. And then you're going to need to help them look at, what's happening, what are the outcomes, evaluation of any of the changes that they've made. Okay, so you're going to help them, but they have to do it. So that's your goal. It's really about just communicating, helping them set goals, helping them accomplish their goals, helping them work on their goals. So again, therapeutic use of self, the definition, ability to use one's personality consciously and in full awareness in an attempt to establish relatedness and to structure their nursing interventions. Their nursing interventions are really going to be focused on coping, focused on goal setting, focused on improving and changing the things that they realistically can change. Okay. And you must have your own self-awareness to be able to do that. You have to know what your beliefs are. You have to understand the human condition. You have to be able to be empathetic for people in these situations and not be critical or not be judgmental, and also not be sort of like, well, this isn't a real condition. This is just a mental problem. They're just a mental case. So in order to work in this environment, you